Welcome to The Explainer. Today, we're not just looking at a run-of-the-mill medical condition. We are embarking on a deep, documentary-style investigation into the invisible biological forces that shape our sleep, our energy, and our entire nervous system. We're going to decode a mystery that millions of people experience every single night, usually without having any idea it's even happening. We're talking about bruxism, what you probably know as teeth grinding. But as we'll discover today, framing this as just a tooth issue, that's like looking at a blaring smoke alarm and thinking your only problem is a loud noise. You're completely missing the fire. Our mission today is to reveal the hidden operating system governing this behavior. We're going to look at deep sleep, brain health, and nervous system regulation to understand what your body is actually trying to tell you.
Okay, let's dive into this. For decades, the universal assumption has been that jaw clenching and teeth grinding are merely localized dental issues. You grind your teeth, you wear down your enamel, you get a plastic mouthguard from your dentist to protect those teeth, end of story, right? Well, actually, wrong. In our investigation today, we have to treat this symptom as our very first major clue. The modern clinical consensus has completely shifted. Bruxism is no longer classified simply as a dental or movement disorder in otherwise healthy people. It's a highly complex oromotor behavior. The jaw, it's simply the messenger. To find the true origin of this activity, we literally have to travel far beyond the mouth.
Part 1. The nervous system distress signal. To really understand this hidden mechanism, we need to zoom deep into the brainstem and examine the highly synchronized architecture of our sleep.
There is a fascinating biological domino effect at play here. Sleep bruxism is triggered by what scientists call microarousals. These are sudden, super brief shifts from deep, restorative sleep into lighter sleep stages. Look at this highly synchronized cascade. It absolutely does not start in the jaw. A shift in your autonomic nervous system towards sympathetic dominance, that's your fight or flight mode, actually begins a full 8 minutes before your jaw ever moves. Think about that for a second. For 8 whole minutes, your nervous system is silently winding up. Then, just 4 seconds before any physical movement, there's a sudden burst of rapid EEG brain activity. Next, your heart rate spikes for exactly 1 cardiac cycle. And then, finally, as the absolute last step in this hidden chain reaction, the jaw muscles activate. The grinding is really just the final echo of a massive nervous system event.
But why does the brain do this? What is the deeper mechanism beneath all of this? Well, here is a revelation that basically changes everything we know about this condition. Bruxism is often an evolutionary protective response. Around 50% of adults with obstructive sleep apnea experience comorbid sleep bruxism. When your airway collapses during sleep, your oxygen drops. Your brainstem detects this life-threatening restriction and immediately fires off an SOS microarousal. The subsequent jaw grinding isn't just some random twitch. It literally forces the mandible, your lower jaw, forward. This mechanical action elevates the upper airway muscle tone and physically forces a collapsed airway back open. Your brain is quite literally sacrificing your teeth to keep you breathing. The consequence that most people never see, though, is what this does to your overall human performance and aging. These rapid-fire microarousals cause chronic sleep fragmentation. So you might be in bed for 8 hours, but your sleep architecture is completely shattered. This leads to reduced deep, slow-wave sleep, disrupted REM cycles, and sustained spikes in your nighttime heart rate and blood pressure. Your brain remains locked in this constant state of partial vigilance. This chronic sympathetic nervous system activation is exactly why you might wake up feeling completely exhausted, foggy, and emotionally drained, despite technically sleeping all night long.
Part 2. The serotonin and dopamine trap. Now, airway restriction and stress aren't the only triggers here. Let's shift our investigation to a completely different chemical layer of this mystery. We're going to look at how modern medications can unknowingly hijack your neurochemical balance.
Now, what's really interesting about this is the delicate biological dance between 2 major neurotransmitters inside your brain. Millions of people are prescribed SSRI or SNRI antidepressants to help with anxiety and depression. And these drugs work wonderfully for many folks by increasing serotonin, which regulates our mood. However, the brain's operating system is deeply, deeply interconnected. Increasing synaptic serotonin actually suppresses dopaminergic activity in your central motor pathways. Dopamine is the chemical that regulates movement and muscle control. So when serotonin goes up artificially, dopamine goes down. This creates an imbalance that literally strips away the brain's ability to inhibit spontaneous jaw movements. It's like a chemical seesaw that gets permanently tipped to one side. And this suppression of dopamine can lead to a condition known as akathisia. If you haven't heard of it, it's a feeling of profound almost unbearable inner restlessness. The medical literature reveals that SSRI-induced bruxism is actually best conceptualized as a specific, localized variant of akathisia. The extrapyramidal system in your brain is basically starved of dopamine, and this central hypodopaminergic state manifests as uncontrollable jaw clenching, often within just a few weeks of starting the medication. It's a striking and frankly sobering example of how altering our chemistry to heal one system can accidentally disrupt an entirely different one.
Fortunately, science offers a really fascinating pharmacological workaround for this. Studies and case reports have shown that a medication called buspirone can act as a direct antidote to this specific SSRI-induced grinding. Buspirone is a 5-HT1A receptor agonist. And hey, without getting too lost in the neurochemical weeds here, it essentially acts on the presynaptic receptors to modulate that serotonergic tone, which indirectly restores dopaminergic activity in the brain. It rebalances that seesaw we just talked about, quieting those restless motor pathways and stopping the jaw clenching. This allows patients to maintain their vital antidepressant therapy without destroying their teeth in the process.
Part 3. The hidden danger of Botox. Let's look at another angle. If the jaw muscles are overactive, a wildly popular modern trend is simply to paralyze them using Botox injections. It sounds like a super quick fix, right? But as we investigate further, we uncover a massive hidden danger. While Botox definitely offers temporary symptomatic relief by weakening the masseter and temporalis muscles, the long-term radiological findings are genuinely shocking. Multiple studies have highlighted that long-term repeated muscle unloading can lead to severe osteoporosis-like bone density reduction, specifically at the mandibular condylar head and ramus. Let that sink in. When you paralyze the muscle, the bone it's attached to literally begins to dissolve.
So, the crucial point here comes down to a strict biological rule called Wolff's Law. Bone is not just dead structural tissue, it is highly dynamic. Wolff's Law dictates that bone resorbs in areas of disuse and thickens in response to mechanical loading. It's the ultimate use it or lose it principle, completely identical to what astronauts experience in zero gravity when they lose bone mass. When Botox paralyzes the jaw muscles, the mechanical loads normally placed upon the mandible drop dramatically. The body senses this sudden lack of force and essentially decides, hey, we no longer need to maintain dense bone in this area, so bone resorption outpaces bone formation.
The cascading, invisible consequences of treating TMJ pain with long-term Botox are profound. Beyond the initial bone density and volume loss we just discussed, many patients actually rely on that jaw muscle strength for basic joint stability. Weakening these muscles can cause jaw shifting, painful subluxations, and severe instability. And this is especially true for patients with generalized joint hypermobility or Ehlers-Danlos syndrome. Furthermore, if the facial pain is actually being driven by a neck issue, by sleep apnea, or maybe by a misdiagnosed headache disorder, well, paralyzing the jaw merely masks the true root cause while introducing an entirely new kind of structural damage. Part 4. Retraining the subconscious brain. If paralyzing the muscle is dangerous, and plastic mouthguards just protect the teeth without actually stopping the muscle contraction, what exactly is the solution? We are pivoting now to a highly empowering new paradigm. This represents a massive, fundamental shift in how we understand and treat human biology. The old paradigm viewed bruxism as a localized mechanical issue that just needed to be blocked with plastic night guards or paralyzed with neurotoxins. But the new paradigm, it recognizes bruxism for what it truly is, a central nervous system behavior. Because awake bruxism is cortically mediated and sleep bruxism is tied to those autonomic arousals we mapped out earlier, the most effective intervention is actually neurosensory biofeedback. It's about teaching the brain to regulate itself. And this brilliantly illustrates how modern wearable tech fits into the picture. Devices like the Savin or Zareen utilize this exact biofeedback loop. Step 1, a highly sensitive sensor detects the precise onset of a jaw clench. Step 2, the device instantly emits a gentle, low-intensity vibration. Step 3 is where the magic happens. Your subconscious brain processes the sensory input during light sleep. It registers the cue, and in step 4, it automatically prompts the masticatory muscles to relax. The incredible part about all of this entire loop happens without fully waking you up or disrupting that crucial deep sleep architecture we need for recovery. It creates a profound subconscious reflex. The jaw muscle gets conditioned not to sustain a contraction because it is repeatedly prompted to just let go.
And the clinical data on this is amazing. It typically takes just 2 weeks of this consistent nightly feedback to drastically reduce grinding frequency. Within just 14 days, you can essentially rewire the central nervous system to break a destructive habit loop. It offers a sustainable exit strategy that doesn't just manage the damage, but actually heals the underlying behavior.
Which brings us to the ultimate, incredibly provocative question we all must ask about our health. Are you treating the symptom or are you actually healing the system? Whether it's recognizing a collapsed airway, understanding that delicate neurochemical seesaw of serotonin and dopamine, avoiding the structural collapse of Wolff's Law, or utilizing neuroplasticity to retrain the brain, Bruxism is absolutely not just about teeth. It is a powerful window into the hidden operating manual of the human body. Listen to the signals your nervous system is sending you. Thank you so much for joining me on this deep dive today. Stay curious, keep seeking those deeper mechanisms, and I'll see you in the next explainer.